Bismillahirrahmanirrahim. I'm Muhammad Sadul Islam Sharkar from Chittagong University, again in front of you to discuss about the symptoms of COVID-19. What will you do with mild symptoms of COVID-19? What measures will you take with the symptoms of COVID-19? And how will you stay at your home when you are suffering from COVID-19? And that means when you are infected by coronavirus. So I will try to find out the answers of all those questions that I have uttered in front of you one by one. Right now we know there is no medicines, there is no drugs that have been clinically proven to reduce your symptoms, clinically proven to reduce the severity of COVID-19, and there is no drugs that have been clinically proven to lessen ever the symptoms of COVID-19. And so far I have heard there, and you also heard it, that there is no vaccines still now for the treatment of COVID-19, and that have not been clinically proven to kill the virus or stop the multiplication of virus, or act as a virucidal or virostatic. That means virucidal means that will kill virus, and virostatic means that will stop the multiplication of the virus. So what will we do if we are infected by novel coronavirus? You are, for example, you are feeling sick, we are feeling weak, and we are suffering from the symptoms, mild symptoms of COVID-19. And if the test has come back positive, what will you do at the time? If the test is positive, and if you are suffering from COVID-19, at that time what will you do? Uh, the doctors are saying that you should stay at home. You should start your self-management similar to other colds or other flu. And you as a self-management, as a part of self-management, you should isolate yourself away from the members of your family, and you should go under self-isolation, I mean self-quarantine. That is, we are saying home quarantine. And we should watch our symptoms, and we should track our symptoms, and we should keep our watchful eye on the fluctuation of our symptoms from mild to severe. In case of stay home, what will you do during stay at home? That is, say that you should be in a single room, and you will be the only person in your room, and you will use a single bathroom, an individual bathroom. It is also said that we should sleep alone, and we should avoid close contact of our family members. And we should not, or you should not leave the room, you should not leave the house, and disinfect your room or room floor by some disinfectants each and every day. Uh, and we should, or you should, use mask or disposable tissue, or flexed our elbow when we are, or when you are cough or sneeze. And you have to, I mean, I'm saying what will you do when you are in stay, when you are in home quarantine? You have to take time, you have to allow time for recovery, and you have to take an adequate bed rest. That is called taking rest a lot. During home quarantine or during stay at home, you or we should take sufficient fluid, sufficient water to stay hydrated, to be hydrated, and we should take a little bit sugar and salts with fluids and water, because we know to be hydrated this sugar and salts will help us to be hydrated, because salts and sugar have their property to retain water within our body. But more importantly, we should keep it in our mind that if you are suffering from blood pressure, or if you are suffering from cardiac disease, I mean coronary artery disease, you should not take sugar or salts, because this sugar and salts will increase water retention, and ultimately it will increase blood volume, which will have a negative effect on blood pressure. That means if blood volume is increased, your blood pressure will be increased. So in case of BP patient, in case of coronary artery disease patient, you should not take sugar and salts with your fluids and water. Uh, Not only this, you should or we should take some hot water, especially when coronavirus is in our throat, when we are suffering from throat pain before entering your or our lungs, and we should take hot vapor of hot water, better to inhale hot water vapor, and it will help you to reduce your symptoms. And moreover, above all else, self-isolating is the best way to be safe. Even then, if the situation is so worsen, or you are suffering from severe weakness, or you are suffering from shortness of breath, if you have if you are suffering from trouble breathing, I mean difficult to breathe, what will you do? What will we do? Side by side, if you are suffering from low oxygen supply, uh, and if you are suffering from severe weakness that I have said, and how will we understand, or how will you understand about the short uh, supply of oxygen? You will, if you follow, you will see some bluish color around the lips, blue coloration around the lips, bluish of the lips, and you will suffer from chest pain, because low oxygen supply within the heart muscle will create some pain that is called chest pain or ischemia. So which will create some ischemic heart disease. So due to chest pain or bluish color of the lips, you will simply understand that you are lack of adequate oxygen supply from the lungs, carried by your blood circulation. So in that case, what will you do? What will we do? And if you are suffering from joint pains, if you are suffering from pains within the fingers of hands and feet, and if you have a throat pain, uh, in that case you will seek medical aid, you should seek medical assistance, and you must need medical support, and you need to be hospitalized. So this is all about home quarantine. This is all about taking fluids, and side by side you can take some symptomatic medications. If I have a time, I will say, and I have told about it in my previous video. How will we, or how will you take symptomatic medications when you are suffering from COVID-19? So it is up to each of us to do our part, to help out ourselves, to help out our family members, to help out our society, and to help out our country, and moreover to help out our government to recover from COVID-19. For more information on what to do if you are suffering from COVID-19, or if you are suffering from the symptoms of new coronavirus 2019, check out the guidelines of CDC, I mean Center for Disease Control and Prevention. Check out the guidelines for WHO, and check out the guideline for IEDCR Bangladesh, because these guidelines will give you the idea how will you manage, how will you measure, how will you be precautious or prevent your novel coronavirus virus symptoms. Uh, the CDC offers a free online self checker to help assess whether your symptoms and circumstances indicate or introduce a new coronavirus infection. That means this free online self-checker will assist you that whether your symptoms and circumstances are related with the novel coronavirus infection. Uh, One more important thing that is really a threat for us and very sorrowful for us, that we are losing a lot of people, a lot of valuable souls every day. The US President, I mean Mr. President of USA, reportedly asked his military to arrange 1 lakh body bags. Sorry to say, 1 lakh body bags in somber preparation as a funeral preparation, or as a obsessed preparation for a coronavirus attack of coronavirus death tools in his country. No way, but he has said this because human beings are facing this pandemic from about 3.5 months. So and people are dying every day. More than 1,000 people are dying in USA. So the Mr. President of USA reportedly asked his military to arrange 1 lakh body bags. Sorry, very sorry. We are losing every day. One important thing that I would like to say, uh, mm, uh, uh, some good news from uh, Pittsburgh School of Medicine, USA, that they have claimed that they have prepared a vaccine, and they have taken some trial on a rat, and they have got a good success that these vaccines are producing some antibodies against coronavirus. So it's a good news for us. And so far we have heard there are some other pharmaceuticals companies throughout the world that are claiming that they are near to introduce a new vaccine against new coronavirus. So we are hopefully going to get the vaccines within a few times. Still, then we should wait. We should have a patience. We should look forward and never be panic and never be stressed. And if you want to know about the symptomatic treatment that I have said in my previous video, I can say again, better to take antibiotic during your fever. You can take analgesics during your pain management. You can take some anti-inflammatory drug, NSAID drugs. You can take antihistamine during itching and nasal congestion. You can take some anxiolytic and antidepressant drug due to release from anxiety and stress. You can take some anti-emetic drugs during your vomiting. And for chest pain, lungs pain, you can talk to the chest specialist and talk to the cardiologist. No more today. It's going to be a long, so I want to make it short. I want to make make it close right now. So be cautious, stay home, stay safe, stay with your family members in an isolated way. No more today, more when we meet again, inshallah.